Good afternoon, and thank you for joining us. Today is Tuesday, December 7th, and on today's briefing, we'll hear from Mayor Tom Barrett, Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Chief Health Policy Advisor with Milwaukee County, and Darren Rausch, Health Officer and Director with the Greenfield Health Department. Thank you all for being here, and Mayor Barrett, I'll hand things over to you to get us started.
Well, thank you very much, Catherine, and good afternoon, everyone. Last week, I shared that there is the new variant of COVID-19. I think we all are aware of it now. It's been nonstop, 24 hours a day in the news, the Omicron variant. And it's been detected in multiple countries. It's also been detected here in Milwaukee County, and I'm sure Dr. Weston will share more details later. We know that the variant continues to spread, and it's now in our community with one recorded case. There are clearly a lot of unanswered questions about the severity, about the spread, and we're collecting all the reliable information that we can. I think the one thing that we're seeing right now is that there is absolutely no reason for alarm, but there is always going to be reason for concern. But in the meantime, the tools that we have are the vaccination and the other precautions, the washing of hands, the distancing, the wearing a mask that we've been talking about over and over again. So again, I know that Dr. Weston will share more details on the Omicron variant shortly, and I'll be eager to hear what he has to say, since he obviously comes with a very prolific background and a lot of good scientific information. So let's turn to basketball, and let's turn to the Milwaukee Bucks, who are not only playing well, thank goodness they're playing well, but this past Saturday, the Milwaukee Health Department and the Bucks held another vaccine clinic at the Pfizer Forum, giving participants a chance to take a picture with the Larry O'Brien trophy and to win tickets to that night's game. It was a huge success, with 640 people receiving the vaccine. That breaks down to 531 getting the COVID vaccine and 109 flu shots that were given out. We want to continue to see large increases in vaccinations in our community, especially among our newly eligible group of children. That is very, very important that we get as many children vaccinated as we can. Since this week is National Influenza Vaccination Week, I want to share with you how you can protect yourself from the flu this winter. Influenza activity is on the rise in Milwaukee and nationwide. There was a significant increase in influenza associated hospitalizations in Milwaukee just last week. So again, we're dealing with the COVID-19 pandemic, but there is also what we would call the traditional annual flu that is being spread, and that's hitting us pretty hard right now. There have been 16 influenza-associated hospitalizations so far this year, with 14 of those 16 occurring just this past week alone. This flu virus is found in droplets from the throat and the nose. The virus can be breathed in or picked up from contaminated surfaces. This is another good reason to be wearing that face mask, incidentally. Anyone can get the flu. Adults 65 years and older, pregnant women, young children, and individuals who are immunocompromised are more likely to have flu complications that can result in hospitalizations and sometimes even death. The best way to prevent the flu, just like the best way to prevent COVID-19, is to get the vaccine. Get the flu vaccine. It is safe for anyone 6 months of age and older. The health department has been offering flu shots alongside COVID-19 vaccines at all of our clinics, and flu vaccine is also available across the community at pharmacies and through healthcare providers. Flu shots are covered by most insurance, are low cost, or are free. You can also stop the spread of the flu the same way we stopped the COVID-19 spread, by practicing good hygiene and staying home from work or school when feeling sick. If you haven't yet, please schedule the time to receive your flu shot this week. Approximately 39% of Milwaukee residents received their flu vaccine last year. So let's get our number up this year. I think it's more important to get it up this year simply because last year we were really locked down, and that certainly helped curtail the spread of the traditional flu. But for more information, visit milwaukee.gov/flu. Quick update on our COVID gating metrics, which continue to be concerning. We remain in the extreme transmission category for COVID cases per 100,000 at 319 per 100,000. That number is up significantly from last week, is up very significantly from a month ago at this time. And our positivity rate is now, unfortunately, in the high transmission category. We've crossed that 10% threshold, and we are now at 10.3%. This is also up from last week. The only good news I have to report really is, for the first time, we can say that our vaccination rate for City of Milwaukee adults has crossed the 60% threshold. We are at 60.1% of City of Milwaukee adults, individuals 16 or older, who are fully vaccinated, and over 65%, 65.1% to be exact, of adults have received at least one dose. The vaccination for our kids, for the 5 to 11-year-olds, is still unavailable. The state's Department of Health Services is working through this right now. So our rise in cases corresponds with the rise in testing, in the testing we are seeing. And it's not surprising, I guess, following holiday gatherings, COVID-19 is growing more present in our community. And this is unfortunate because we all know that this is the time of year when people want to get together with our families. But we should be taking the precautions that are necessary, particularly to take care of those loved ones in our lives who might be more susceptible. So please seek out vaccines, including the booster dose if eligible, to protect yourself, your family, and the community. Finally, let's talk about some COVID vaccine clinics. First, second, or booster shots or flu shots are available throughout the city, throughout the week across the city. In addition to our school-based locations, Ascension All Saints Family Health Center and Lamb of God Church are offering vaccinations in the community in partnership with the health department. A full list of vaccination sites can be found at milwaukee.gov/COVIDvax and at healthymke.com. So a lot of information, a lot going on, and I'd like to now turn it over to Dr. Weston. Dr. Weston.
All right, thank you, Mr. Mayor. Good afternoon. First, to our numbers, we're currently seeing in Milwaukee County an average of 424 new COVID cases per day and about 5 deaths every 2 days. We continue to see poor trends in Wisconsin and Milwaukee County. As cases and positivity continues to rise, yesterday we saw a new 2021 record for COVID hospitalizations in the county, 299 people. That's nearly 40 more people hospitalized with COVID just over the weekend. And statewide, we are really struggling with hospital capacity, with just 3% of ICU beds available. And I've heard many people say that this is just due to provider and space shortages rather than really due to COVID. But let's be clear, let's look at the numbers. We have 1,331 ICU beds in the state. Now, 409 of those, that's 31% of our ICU beds, are taken up with patients with COVID. 1 in every 3 ICU patients in the state are COVID patients. You can imagine the effect that has on ICU and broader hospital capacities. And that is why more rural regions of the state are so short on beds. North Central Wisconsin, 1 ICU bed. Northwest Wisconsin, 3 ICU beds. Western Wisconsin, 0 ICU beds. And the entire Fox Valley has 2 ICU beds available. And the COVID cases, the COVID hospitalizations are only rising in the state. Now, to be clear, all of those numbers, the cases, the hospitalizations, and the deaths, are currently due to the Delta variant. That is the variant that we're currently facing, and the one that's causing the current spike in Wisconsin and much of the country and around the world. We know a lot about the Delta variant. We know it's extremely contagious. We know it can cause severe disease, and we know that the vaccine is highly effective against it. But of course, Delta is not the only variant that we have to consider. We also have Omicron. Omicron has over 30 mutations on the spike protein, the part that attaches to our cells, 30 mutations on the spike protein alone. Now, this is concerning and different from what we've seen in the past. The mutations can be hard to understand. I posted a video on Twitter talking in plain terms about mutations, comparing them with Legos. We're all familiar with Legos. If you swap out one piece in your Lego airplane, it might not make a difference at all. But if you swap out the right Lego, it can completely change the function of the plane. That's what we're looking at here. One Lego swapped out, or one mutation in the case of the virus, can change the structure. and make a big difference in how it infects us, how it spreads, and how it evades immunity. You can take a look at the post for more details. It's a short video, and it can help you wrap your head around what can be a confusing concept. Now, we've learned a bit about Omicron in the last couple of weeks since it was first sequenced, but a lot remains unknown. It certainly seems more transmissible than Delta, which means it will more easily spread among our population. We're already seeing that as more and more states pop up sequencing the new variant. Now, this makes masking, distancing, and ventilation more relevant than ever. As for severity, there's been some initial reports that it may be less severe than Delta. Now, it's important to remember that these reports are based on looking at the number of infections in South Africa as compared to the number of hospitalizations in South Africa. How many people infected are getting hospitalized? Now, this data is preliminary, and importantly, the demographics of South Africa skew much younger than the United States. And with a much larger young population, you'd expect more mild disease. So we'll continue to observe what happens in other countries to get a better idea of severity. We don't want to yet jump to any assumptions. As for immune evasion, there is preliminary evidence, but it's pretty compelling evidence that past infection may not be as protective with Omicron as with other variants. And we still await more information on vaccine effectiveness, but judging from past variants we've seen, we would expect vaccine protection, perhaps with some erosion. That is to say, we may get not quite as great a level of protection, but still quite good protection. So we'll certainly continue to watch news on Omicron and hope for a lower severity disease than Delta with a high level of vaccine effectiveness. That would be our best case scenario, a variant that could provide some immune protection without severe disease, but it's just too early to say. In the meantime, we have to continue our high level of caution around Delta. That means vaccine, COVID vaccine, also influenza vaccine. That means COVID boosters. And that means masking, distancing, and ventilating whenever we're indoors in public. Thank you and stay safe, and I'll hand it to Health Officer Rausch.
Thank you very much, Dr. Weston. It's my pleasure to join today to talk a little bit about the case data as well as some vaccination data. So I'll go ahead and share a few slides as I talk, just to kind of give you an overview of what's happening here in Milwaukee County. So we'll start today by looking at the total number of cases across the county. And again, we've continued to say cases are increasing, cases are increasing. Just want to point out something that's become clear since the last time I visited with all of you 2 weeks ago, is that the 7-day averages in the suburbs, the blue line, is now higher than it was back in September and October when we had seen previous spikes in the county. So certainly that's something we're watching. The suburban communities are really blowing up at a higher rate in terms of COVID cases than the city of Milwaukee at the moment. And we see the same thing when we look at this slide, which is children 18 years of age and younger. We see a very sharp increase in both the suburban community and the city of Milwaukee. But again, we're seeing increases and peaks higher in kids than we've seen at any other point, as far as what we've seen in the last year anyway, in our suburban communities. And what really drives the cases in our community is the reproductive number. And we've seen this before. Our reproductive number, when our disease cases are increasing, is always higher than 1. And right now, it's about 1.1 for the city and just a little bit less than that in the suburban communities. So it's driving those cases throughout the county. And you can see that here as we look, the reproductive rate is still increasing in the city of Milwaukee, but it's kind of trending down in the suburban communities. And again, this is very fluid, but it speaks to why we continue to have more cases, because each case is infecting 1.1 other people, and we have these situations that explode. When you couple that high reproductive number with holiday events, Thanksgiving, Hanukkah, other gatherings, over the last several weeks, we can see very easily how one case can become multiple cases throughout the community. On the vaccine front, we're very happy to see doses go into arms, and that is a great story that we're seeing. Again, in the early part of the year, huge peaks of primary vaccination doses, either dose 1 or the completed dose. So the dark blue being dose 1, the light blue being dose 2, and certainly a lot of doses in the last several months boostering. So providing that third dose, which is really helping to build the immunity. Unfortunately, we're seeing a decrease in the primary series uptake for vaccination, but we're seeing a lot of boosters. So there is a little bit of a trade-off. You'll see that we've seen a peak here, or seen a little bit of a peak here in primary series, but if I go to the next slide, you actually see that that peak is largely driven by Pfizer doses for 5 to 11-year-olds. So again, we can't discount the fact that the vaccine works, the vaccine is effective, the vaccine is an important mitigation strategy to this pandemic. And not only are we talking about the primary series, but we're talking about boosters for adults, and we're also talking about getting shots into kids' arms, the 5 to 11-year-olds. So we are seeing some increases there, but again, these numbers are way too low, and we know we still have some disparities in getting these vaccines out, both by age and race and ethnicity. So on this slide, I reflect percentage of county residents with at least 1 dose of COVID-19. And largely I shared this just to show the increased growth in the 5 to 11-year-olds. We're almost up to 15% of our 5 to 11-year-olds in the county who have received 1 dose, and that's great. When we look at completion, we don't see quite enough of a blip yet, because there's only about 500 or 600 kids 5 to 11 who've completed their series, but there'll certainly be more in the data that's coming out this coming week and next week. So we want to continue to push that message that vaccination is important for all ages that are eligible. And lastly, I want to reflect that we still have, sadly, some disparities in vaccine uptake. We continue to reflect that Hispanic and African American communities in our county have rates less than 50% fully vaccinated. So we want to continue to see those rates increase. So I would urge all of you to continue to talk to your friends, your family, your coworkers about the importance of vaccine. Any one of those conversations can have a very positive impact on people getting vaccinated. And as been mentioned previously, it is National Influenza Vaccination Week. And in addition to COVID vaccination, I want to encourage all of you to get your influenza vaccination as well. As Mayor Barrett spoke earlier, last year's flu season was largely non-existent because we were either locked down to some extent, schools were largely virtual, and we had strong mask mandates or recommendations in place. And that really curtailed the flu season last year. So if you want to see what happened in last year's flu season, just follow this magenta line here at the bottom, pink, magenta, whatever color you think it is. But that was last year's flu season, really, really low, well below the threshold of 2.5% visits for influenza-like illness. But if we start to track this year, here in the line with the triangles, it's starting to approximate what we've seen in other years, meaning we're starting to see an increase that will continue on into next year and likely peak sometime in January and February. So again, vaccination is important both for COVID and for influenza, and I encourage all of you to do your part to keep both your family, your friends, your coworkers, everyone safe in the community. So with that, I am done, and I will turn it back over to Catherine.
Thank you, Director Rausch. Our first question comes from Kent Wainscott with WISN 12, and he wants to ask his question to Dr. Weston.
Hey, Doctor, how are you? Thank you for taking this. We're hearing a lot about the numbers in the hospital, the surge being driven by unvaccinated patients, but it seems that percentages or hard numbers are hard to come by or hard to find. What percentage of the COVID hospitalizations are among unvaccinated patients as opposed to breakthrough positive cases?
Yeah, thanks, Kent. So I know the state has released data on this statewide. I'm not sure when they plan for updates on that, but as for local hospital data, we don't have data. We do publicly provide the data on the COVID hospitalizations. We don't have data specific to percentage of hospitalized COVID patients that are unvaccinated versus vaccinated, we being the county. Whether the hospitals have that, I'm not sure. However, I would say we've seen many examples from our state, from other states, from the CDC, from other health systems that have done this as part of a study that show that the level of protection of the vaccine against hospitalizations is incredibly high. The vast majority of patients hospitalized with COVID in every example are not vaccinated. And the booster is also a critical element to really maximize your protection against severe disease.
Thank you.
Thanks.
Our next question is from Mary Jo Olub with TMJ4. Similar question. She's wondering, how are Milwaukee County and southeastern Wisconsin hospitals in terms of capacity compared to other regions? And how are they managing the workload, embracing for any influx of patients, COVID or non-COVID?
So in southeastern Wisconsin, we're obviously lucky to have a number of large health systems, but it's important to remember we also have a large population that uses those large health systems. So even though we might be slightly better off than the rest of the state, we still only have about 5% of our ICU beds available. So as we see cases and hospitalizations rising in Milwaukee County, it certainly becomes concerning for how well we can manage all those patients coming in hospitals that are getting more and more full.
Thank you, Dr. Weston. Our next question is for the mayor. It comes from Chuck Korbach with WUWM. He says, Mayor, if you're happy with the vax numbers from Pfizer of last Saturday, what about more incentive programs? It is the holiday gift season.
It is, in fact, the holiday gift season. You're correct. Absolutely, you're correct there, Chuck. And I was happy. I was happy with the numbers that we saw and the number of individuals that came in the Pfizer form. We have tried many, many different variations of the theme on how to get people to get vaccinated. Some have been successful, some have not been as successful. And I continue to be open to any creative ideas to get people vaccinated. That is the prize. My eye stays on the prize of getting people vaccinated. So I'm certainly open. I know that our health commissioner is open to trying to find ways for people to understand the importance of getting vaccinated. So I'm trying to infer from your comment how the holiday gift comes into this. So if you can elaborate on that, that would be great, but I'm open to your idea, Chuck, whatever it is.
Thank you, Mayor. We'll wait to see if Chuck has any good holiday gift suggestions here. Our next question is from Allison Durr with the Milwaukee Journal Sentinel. Perhaps it's for Dr. Weston. Given current hospitalization numbers, was decommissioning the field hospital at State Fair Park premature? And as a separate question, should families cancel Christmas gatherings?
So for the first question about kind of hospital capacity and that overflow option that we had before of the State Fairfield facility, we have our hospitals have developed a pretty robust plan for how to surge their spaces, how to increase their normal bed space, how to increase their ICU bed space if they need to. So I think they'll continue to look at those plans. However, it is certainly concerning as we see more and more patients being hospitalized. It's not a line that's leveling off. It's a line that is getting steeper and steeper. So I think that's why vaccination and mitigation measures are so important, which leads to your next question, which I think was, should we cancel other holiday gatherings? I think we need to be cautious with holiday gatherings, to be sure. We need to especially be cautious when we're thinking of traveling. Anytime you travel, you're around other people, it's easier to spread disease. But even locally, if you're having a holiday gathering, and we'll talk more about this as they get closer, but it's really about those layers of protection. If everybody in your group is vaccinated, you're a lot safer. If you have people who aren't vaccinated, you have to be cautious there. If you are going to an area where you're indoors in public, wear a mask. And think about rapid tests, especially for those sort of holiday gatherings. We'll talk more about that. I don't know that everybody needs to cancel all their plans, but I think we absolutely need to be careful with the plans that we have and consider COVID. Unfortunately, once again, consider COVID when making our holiday plans.
Eric Gunn with the Wisconsin Examiner has a follow-up question regarding the epidemiology report. So perhaps Dr. Rausch, you can jump in, and of course, Dr. Weston, if you have additional commentary here. Why are the suburbs showing more dramatic increase in cases compared with the city? Does this reflect different vaccination rates between city and suburbs? And is there less vaccination in suburbs? Or is there a difference between how the city versus the suburban residents are behaving with regards to mitigation or something else?
Yeah, I think that's a great question, and it's multifaceted, as Eric points out in his question. We have seen throughout the 21 months of the pandemic, there have been times where the city of Milwaukee had higher cases and a higher case growth rate than the suburban communities. And we've seen times like now when the suburban communities have higher case growth rates than the city of Milwaukee. It's been an important story for us to tell because it speaks to where the level of risk is, who really needs vaccine, who needs education. And using that data was very important in the early months of the pandemic to drive our response. Currently, the data in our reports would reflect that the vaccination levels in the suburban communities are higher than in the city of Milwaukee, but yet we're seeing more cases currently in the suburban communities. And so I think back to the layers of Swiss cheese analogy that I've talked about before, and I was going to make my comments today dairy-free, so I apologize for bringing up Swiss cheese. But all of those mitigation measures are important. So if we have a community that has schools where they're not requiring masking, or they have differential assessments of how people are masking, maybe it's high schoolers aren't masked and others are. Those are having an impact. And I'm not saying schools are the entire issue, but certainly we know that when you walk through the community, and Dr. Weston and I have had these conversations in sidebars over the last several weeks, when you go to certain communities, it's easy to feel like the pandemic is over because no one's wearing a mask. No one is doing the things that we know that keep them safe. But if you go into a community, say like Madison, you see lots of masks, you see signage, and you see reminders on stores and at businesses. And so those characteristics are really going to be driving what we're seeing in cases. And certainly right now, there's a big surge in the suburban communities with case rates in our schools and case rates in our communities that are higher than they have been during this school year. And that's something we need to continue to tease out. We need to look not only at the vaccination numbers for the primary series, but also look at who's getting boosted and continue to put out those messages about the importance of vaccination and those mitigation measures.
Thank you, Director Rausch. Our next question comes from Emerson Lehman with CBS 58, and he would like to ask his question to our guests. So Emerson.
Yes, thank you. So this is for Dr. Weston. You say that masking is more important than ever right now. The city has the mask advisory in place, but still no mandate. Do you feel that it's time for city officials to really start considering a mask mandate as numbers continue to rise?
Yeah, so we know that masks work. We know that there's different levels of masks, different sort of masks work better. I think I would defer to the city on what their plans are for masking going forward. But I would say, generally speaking, for each individual, if you're indoors, if you're in public, you want to wear a mask. I think you also, and we'll talk about this in the coming weeks, because I think it's an important topic. You want to also think about what kind of mask you're wearing, especially with seeing that Omicron is more transmissible than Delta. That means cloth masks are not going to be as effective as they were with Delta. It means wearing a surgical paper mask that you can get easily online or at stores is going to be better. It means a KN95 is even better than that. So I think absolutely this is a time for people to be wearing masks when you go to the grocery store, when you go to the mall, when you're indoors in public. Please just wear a mask. It's easy, it's simple, and it keeps you and others safe.
And Emerson, I know you had another question, so feel free to ask that.
Yes, and just to follow up with that, the president of Freighter today said that they are at full capacity, period. Do you have any information that you would be willing to share with that or be able to elaborate on those hospital levels?
I think, yeah, I mean, we talked a lot about hospital levels. I think we're at a critical time for our hospitals when entire regions of our state have single digits. And we're not talking, 9, 10, we're talking 0, 1, 2. The entire Fox Valley has 2 ICU beds available. I mean, think of all the people that live in the Fox Valley, and there's 2 beds for people who have those critical sort of needs. And those aren't all COVID's needs. These are people with heart attacks, people with strokes, people with trauma, require those beds and rely on those beds. So I think we're at a dangerous point for hospitalizations in the state. We're at a dangerous point for COVID in the state. That's due to Delta. And we have the unknown of Omicron on the horizon. So it's a time to buckle down. It's a time to mask up, to keep your distance, ventilate. And if you've been on the wall, if you've been hedging about vaccination, now's the time to pull the trigger, to get vaccinated. And certainly if you've already been vaccinated, follow through, get boosted, make sure you maximize your protection.
Thank you, Dr. Weston. We've got just 2 more questions before we conclude our briefing. The first one is a follow-up from Eric Gunn with the Wisconsin Examiner. He's wondering for Dr. Weston, as you talk about masks, what about cloth masks with paper filter inserts? How do they compare?
A cloth mask with a paper filter insert. I can't say I've seen a lot of cloth masks with a paper filter insert. Certainly masking is all about those layers. We talk about layers of protection, but physical layers of protection. A single layer of cloth versus a double layer of cloth. Paper masks tend to be better because of the way that the weave is. KN95 and N95 masks tend to be even better, in part because they don't allow as large particles in. They're also specially charged so that they kind of grab onto those particles and don't let them get into your respiratory system. So you want to think about the different masks that you're wearing and really wear the highest quality mask that works for you, that's comfortable for you, that you're able to get your hands on, and that you're going to keep on. If I see a lot of people, they walk and each time they talk, they pull their mask off to talk. There's no point. There's no point in wearing a mask if you're doing that. So wear a mask that you're going to keep on, that fits well and works for you.
Thank you. And I do see just 2 more questions here. Follow up for the mayor from Chuck Kornbach. Mayor, how many federal dollars are available to fund incentives? Maybe food, gift card related, maybe a Giannis bobblehead incentive.
Well, we have our second tranche of dollars, which comes out to $197 million. That can be used for a wide range of different options that would be suitable for the community. So certainly, I think that the resources would be there for additional incentives. We have done the cash incentives previously with some success, but we're certainly open, again, where we see them being effective, we want to go that way. And so we have not discussed a Giannis bobblehead, but it's certainly something I'll bring up with the health department officials. But I appreciate the very creative thinking, that's for sure.
Thank you, Mayor. And just a quick follow-up question from Allison Durr about the data. For Dr. Weston, the most recent data on the dashboard shows 261 hospitalizations as of December 1st. What date does Dr. Weston's data reflect regarding the record number of hospitalizations in the county for this year?
Yeah, thanks for pointing that out. We had an issue with our dashboard refresh this morning due to some data issues with how it gets handed down from the state. So we weren't able to do our full update this morning, but the numbers I gave you, 299 hospitalizations, that was yesterday. We usually get our hospitalization data Monday, put it in Tuesday morning at 1 a.m. Through the dashboard update process. So 299 was the number of hospitalizations yesterday. And then 424 was our 7-day average of cases. So you won't see that on the dashboard today either. Our data folks are frantically trying to update all that and working with the state to get accurate data. And then we are at, I believe it's 2.4 deaths per day, if you want the exact numbers. So it's about 5 deaths every 2 days is where we're at.
All right, thank you for that point of clarification. Those are all of the questions I have in the chat. Thank you all for joining, and we will see you next week.
Thank you all.
Thanks, everyone.
Take care.